Hi guys, Dr. Parson here again. Talked about low back pain on one of our videos and I get asked a lot. Neck pain. Neck pain is probably the second most common thing we treat in this office. And I want to tell you a little bit about it and how we can help you. Should chiropractic be where you go to seek care? Neck pain, stiffness, and often pain down the arms, and this may be what you're searching for, the answers. It can really change your whole life and change your whole demeanor. Oftentimes it's hard to turn or look up or sleep or turn down, up, you name it, just stiff, achy, and sometimes pain to the shoulders often refers that way, and it's a common ailment. And again, it can change your whole life. You're miserable, you're kind of grumpy, and hard to look over your shoulder driving, and I want you to be able to see me when we drive. So can chiropractic help? Well, absolutely in most cases. Most neck pain is structural. What do I mean? Well, it's hard to just have neck pain because of the muscles in your neck. It really is. The muscles attached to the spine and chronic, and especially long-term conditions, have the spine is considered structure, the muscle is considered functional. So we're going to use those words. So we're going to stick structural. And in my experience, in about 30 years or so, that most neck pain is structural, and then you got to fix the functional along with that. But oftentimes stretching and just rubbing it out is temporary, but it comes right back. Stiffness pain usually is in the joints. So when we say structural, that refers to the spine, the ligaments, the muscles, the tendons, the joints, the facet joints, which is a common area we'll talk about, the disc. Spurs, all those things, degenerative disc that you hear. Common conditions seen in our office for the last, like I said, 30 years include disc degeneration. Sometimes I have people ask me like I haven't ever seen that. It's about as common as dirt, unfortunately. Spurs on the neck, facet arthritis, one of the real pain producers. But then you have to consider the cause of disc degeneration. You know, people go, I got degenerative disc. Well, that's arthritis. That's no different than arthritis of your knee. It's just in your spine. It's arthritic decay. When you have degenerative disc, there is a decay that's occurring, and that comes down to what causes these things. Touching on that, we'll move right into that. Causes of this decay and why your necks look like they do when they come in the office. It can be from whiplash, posture, the head's going forward, and we got the, we see all these people like so. Even the birth process can create a traumatic insult to the neck at an early age, gone undetected for a long time, pulling that baby out of a C-section. Just some of the causes. I could go for days on that. And then we come to misaligned vertebra. There's the misalignments that we see. In other words, you see a neck that's supposed to have a curve like that, and the curve is actually that way. Reverse curves, S curves. In fact, over my shoulder is I don't know if you see it too well. These x-rays don't show up too well, but that curve is an S shape, and it's got all kinds of nasty degenerative changes going on in here, but it's an S shape, and it should be a C shape. I wish it was a little clearer, but the point is and this guy's having a lot of problems turning his neck. He really doesn't have a lot of pain, but he's losing his range of motion at an early age. Chiropractic looks to these causes and attempts to restore the normal structural integrity of the spine as close to normal. You can't fix arthritis. I wish I could. You can make it better. You can slow the process down. You can make it more functional and less painful. But let's be clear about that. But with patience and work, the spine can be moved better, misalignments reduced, curves can be changed, and posture can be improved. Thus, the pain subsides, the muscles relax because the muscles are attached to the spine, and the nerve settles down, and your range of motion improves. With time, it doesn't happen overnight. Usually these problems like this one over here took for 30, 40 years to get there, and you have to work at this to get better spine and improve without the use of medications and such. They just handle the symptoms, and it just gets worse. Some conditions can the neck can produce severe nerve pain and may need additional intervention by a chiropractor and a medical doctor together. That's a good prescription. So it's important to know that the chiropractors are highly trained in rehabilitation of the spine. It's just not PTs. Chiropractors, that's our world. We know when we get the structural right, then we start rehabbing it, and things even work better. That means when the time comes, exercises and stretches for your condition will be prescribed. Chiropractors are known for their really great work to relieve pinched nerves. I've had people ask, do y'all treat pinched nerves? Whoa, that's kind of what we do. So you think you got a pinched nerve in your neck, that's a chiropractor's probably the best person to see for that, to get that resolved, some of them very quickly. But the thing about it, we're not treating the nerves themselves. We're using the joints and the vertebrae of the spine to get to those nerves. You get relieved pressure through the manipulation of the joints. The nerves get happier, and you feel better. So, in summary, chiropractic care seeks to reduce symptoms. That's what you come in for. I got that. We want to do that as fast as possible because you're happier and we're happier. But we're trying to correct the cause, what got you here, teach you how to manage it, the neck in the future, for instance, exercises, you name it. But we don't ever want it to recur, right? And that's a journey. And there's usually a lot of work up here, then over time, less and less. But it's a journey, and it's a consistency to change necks that come into this office. Make chiropractic your first choice. Have a good day.